Good afternoon and welcome to the COPS Tribal Methamphetamine Webinar, Training and Technical Assistance Series sponsored by Strategic Applications International Tribal Meth Fellows. My name is Anthony Colson and I'll be your moderator today. Today's topic is Confronting the Meth User, what every cop needs to know, the good, the bad, and the ugly. Before we begin, I need to let you know that this webinar service includes a feature that allows audio and any documents and other materials exchanged or viewed during the session to be recorded. By joining this session, you automatically consent to such recording. If you do not consent to the recording, please disconnect from the webinar at this time. Before we begin, I'd like to let our participants know that the audio portion of today's webinar will be available along with the accompanying PowerPoint presentation. These materials should be posted later this week and will be accessible from the Methepedia. That's METHPEDIA.org under http://www.methepedia.org. You'll find the audio files and PowerPoint presentations of previous webinars in the series there as well. During the presentation from our speaker, you, the audience, will be in the listen mode only. At the end of the guest presentation, you will have an opportunity to participate in a moderated question and answer session. Although our Q&A session will occur after the presentation, you may submit a question online at any time during the webinar. To submit a question for our presenter, please select the Q&A drop-down menu, and type your question in the top box. Then click on the word Send on the bottom right-hand side of the box. Once the polling starts, the questions will appear in the right-hand panel under polling. At the end of the question and answer period, there will be a polling session. Once the polling starts, the questions will appear in the right-hand panel under polling, right under the Q&A window. Attendees will then answer the polling questions. There are a total of 7, and then click Submit. We'd also like to note that the views of today's presenters are not necessarily the views of Strategic Applications International or the COPS Office, U.S. Department of Justice, which sponsors the COPS Tribal Methamphetamine grants for 2010 and 2011. Again, our topic today is Confronting the Meth User, what every cop needs to know, the good, the bad, and the ugly. Our presenter is Dr. Matthias Strickerts. Dr. Strickerts is employed as a supervising psychologist of behavioral health for the Cheyenne River Sioux tribe. He is a licensed psychologist, a certified chemical dependency counselor, level 3, with the International Certification and Reciprocity Consortium, ICRC endorsement, and a certified prevention panelist with ICRC endorsement. His initial work with methamphetamine addicted persons and which included pregnant women, started in 1974 during his doctoral training at Texas Tech University, where he graduated in 1976. He has been the director of 2 alcohol and drug programs, one through the state of South Dakota and one at the CRST, the Cheyenne River Sioux Tribe, Tribal Health Department. His experience has included field work with stimulant-dependent persons in their homes, in the emergency room, and includes testimony in both state and federal venues. Dr. Strickerts, welcome. It's all yours. Take it away.
Good morning. Good morning, and a fond good morning from the Cheyenne River Sioux Tribe in Eagle Butte, South Dakota. And thank you very much for letting me talk with all of you today. I have a lot of information and certainly look forward to being able to share it with you. I'm waiting for the PowerPoint to load up on my site at this point for the first slide. Thank you very much. Ready to go. I have a lot of information, and the information that I have for you all as police officers is to supplement what you already know, not only about yourself and how you respond to people in the field, perhaps even in your detention facilities, perhaps in other places that you work, as well as how you respond as a police officer and your training. We all have our own experiences. We all have our own ways of thinking. And I also do want to acknowledge that there are geographical differences in some of the slang that is used to describe many of the things that are involved in the methamphetamine problem that does exist. My experience in methamphetamine to this date has been throughout the states of Texas, New Mexico, South Dakota, Tennessee, Iowa, Nebraska, Minnesota, basically through the Midwest, both in my experience as a psychologist, drug and alcohol counselor, as well as the time that I was a police officer in the state of Texas. As we go through this, I would like to let all of you know that there's going to be some things that are highlighted in red. Those are some areas I want to emphasize to you as law enforcement officers. And if you would, conceptualize right now that pollution is something that we experience. This is actually a symbol of the body. Here we have a beach that we would want to be able to play with our kids and our spouses and our significant others. But something has happened in this beach. All of the things that you see on this pristine beach actually represents the body system. That's why I put that up. And here we have another picture of the body system. When we take a look at this pollution, we can see individual objects. When a meth user uses meth, they do not see the individual ingredients that are in the meth that contribute to their pollution. They just see the stuff that makes them feel good. The river systems here, the lake systems here, are the pollutions that take place within a body, within the mind, the thinking, the cognitive, the mental state of the individual. It becomes part of family pollution, and family may actually be a unit of family, the extended family, and it becomes part of the community pollution that the person lives in. When we go through this, we hope to help you understand how the ingredients contribute to what you actually see, meet, and encounter in the street. This is the good, the bad, and the ugly. So you'll be hearing some things today that you may disagree with because, for the most part, meth is experienced differently depending on which side of the street you're on. The law enforcement side of the street is very much different than the user side of the street. It's a powerful and synthetic nervous system stimulant. That means the brain, the nerves, the spinal cord have something happen to it that people like. They like it as much as persons that don't use it may like beef, steak, ice cream, chocolate. It is legally provided to treat people for attention disorder. So we know that it has some positive effects on the brain. However, that disoxin is really a synthesized methamphetamine without the impurities, and it doesn't give the high. But some people use their form of meth in illegal kinds of stimulants that they get. It's made in illegal or hidden labs around the U.S. and Mexico, and approximately 85% of all of the labs that have been discovered seem to be related to methamphetamine production because, number one, it sells. It's a good occupation for some people, and it gives the consumer the substance that they want. It's classified as a Schedule II controlled substance. It certainly does present some significant problems for people. Now, we're going to take a look at low-risk meth, and we're going to take a look at high-risk meth on the global level. First of all, low-risk meth. These are people in their work environments that use meth to pull an extra shift. Over-the-road truckers, and I would imagine most law enforcement officers have come across people that are driving for an occupation and they're using meth to make a long haul. They're using meth to maybe even work outside of what their contracts have, as well as what their log inventories show that they are doing. We find it very common in meat packers. We find it in health providers. Occasionally we find it in law enforcement. We find it in factory workers. People use some to help them get through an extra shift. And for some families, the extra shift is time and a half. It is the way they have to survive. Some people use it in their play environments to feel good and enhance some of their activities. Gambling, some contact sports. And one of the things that we often find in reservations or in places where there are non-sanctioned contact sports, such as MMAs, tough man contests, smokers that are not sanctioned by USA Boxing or some other, that some of the people that are involved use methamphetamines not only for courage but for energy, for speed, because it actually does assist them in some ways in their abilities to fight. Some people use it in nightlife to stay awake. And some people have discovered that methamphetamine really does something for sexual activity. It sometimes passes the time during sex rather than a person meets a person. The sex feels good. It lowers inhibition. It increases sexual pleasure for some people, most people, some research would say. It makes for longer lasting sex. And sometimes that's a negative instead of a positive. There's abrasions and there happens to be STD present when the sexual activity takes place. It helps some people meet people. Some people feel less anxious in sexual encounters. And there's often added excitement to an existing relationship takes place when there is stimulant use. Now, on the other hand, we have high-risk use. In populations where, especially there's needle use or there's sexual activity where there are STDs, the hepatitis problem makes itself present very quickly among the people that interact with each other within their circles. Definitely HIV and AIDS has been an issue with methamphetamine throughout the United States. Injuries from motor vehicle collisions, motor vehicle crashes, murder and assault are one of those things that we do know is related to high-risk meth use. And I've got up here an important thing for law enforcement officers, because we never want to forget that some of the people that we encounter in our communities are just mean. They were mean before they began using meth. Meth may make them meaner, and when meth becomes their way of life, it may cause them to do things that are higher risk, initiate more violence as just a way of experiencing fun and stimulation. If you've worked any of the sites in which somebody who was on meth had harmed somebody, perhaps killed somebody, and there became a frenzy in the kill from the methamphetamine with certain kinds of people, that adds to their excitement of the meth high. So we don't want to forget that some people enjoy meth because it seems to give them permission, or they take permission from the meth use, that they can just do things, whatever they want, and not have to worry about it. And of course, high risk when there are STDs present, or when there's a trade-off of sex for drugs, and within certain groups, STDs, urinary tract infections, become somewhat rampant. And then sex for sex becomes risky business, even when couples have used it and then they decide they're going to expand their sexual horizons outside of their own bedroom. I want to invite you to recall a Chinese proverb regarding alcohol. It said, first the man takes the drink. Then the drink takes the drink, then the drink takes the man. This is the nature of addiction. In meth, it's the same thing. First the man takes the meth, and when I say man, I mean person, men or women, adult or child, adolescent or geriatrics. First the man takes the meth, then the meth craving causes the meth to be needed, and then the meth takes the man. In the second area here, then the meth takes the meth, and then the meth takes the man. Now we're into, in this proverb, what is really defined as out of control use. For law enforcement, the vast majority of methamphetamine users will never have contact with law enforcement. If you think for a moment that with the numbers of people that are using methamphetamine versus the numbers that get worked by law enforcement, the numbers that get worked by law enforcement is the actual tip of the iceberg when it comes to methamphetamine issues. Now, what causes problems with methamphetamine to the user? Number one, it's the ingredients itself. The actual 300 plus ingredients that can be in methamphetamine. And then we have the use patterns of the methamphetamine. I'm going to talk specifically about the use patterns in a few moments. And then it is the change in brain functions from this particular drug. This is a very toxic drug of over 300 and some generally toxic chemicals that can go into it or be created through the process of using the methamphetamine. So the problems outside of the person have to do with how a person adopts to ingredients, patterns in their brain. The ingredients in meth, there are more than 300 chemicals that are both classified as essential chemicals, which are salts and solvents, acids and alkalines, things that catalyze the manufacturing process. And remember, manufacturing methamphetamine is a business, it's an occupation for many people, and it is quite problematic for the people that manufacture it, as well as other people who come in contact with those places. The essential chemicals do not become part of the final molecular structure of the drug, but can often be found in assays of persons who have used those chemicals. Precursors are substances that in nature might be inactive. However, when combined with another chemical, the result is a brand new product. And with bath salts, K2, and some of those kinds of things, we see all kinds of really new things that are developing each time one of the new chemicals are added to just change the product. Precursor chemicals become part of the product, essential chemicals do not. Now, for law enforcement, if you think about it, we have approximately 34 precursor chemicals. The most common are ephedrine and pseudoephedrine. And some of you might remember the drug called ephedra, which was basically banned in the early 2000s, about 2004, I believe. There were over 18,000 complaints that this stimulant drug that was used in cough medicine, used in some things that help clear up stuffiness, nasal congestion, actually triggered violence, memory lapses, psychoses, aggression. And many of you probably will remember if the Red Bulls in your area were actually sold, that ephedra was the primary stimulant ingredient up until about 2004 in Red Bull, when it became off and scheduled drug where it could not be utilized over the counter. The essential and precursor chemicals, some are created or needed to create the euphoria, the very pleasant high, the exciting sense of positive self-worth. The people that manufacture it either manufacture with euphoria in mind, it feels good in mind, making the product seem as if it's better, and they even use some tricks to trick people into this is a new and better kind of methamphetamine. The chemicals create the high, and it's the high that's sold and produced. As you just take a look at this, these are some of the common ingredients. You all have maybe seen these lists before, and there's nothing on this list, with the exception of pseudoephedrine, the cold tablets, and the ephedrine, the cold tablets, MSM for some things that are used in certain medicines. But if you take a look at these, there is nothing involved at all in the process of understanding a meth addict saying, oh yes, I'm going to go out and I'm going to take a little anhydrous ammonia, I'm going to do a little bit of lye. There's nothing that really tells, from looking at these chemicals, that the meth addict somewhere growing up said, yep, someday I'm going to use these kinds of things. The brain forgets, once a person starts using methamphetamine, that chemicals are not readily apparent, and there is not a conscious choice that people will be using. Now, there are patterns in which meth is used and meth is taken into the body. It's smoked in pipes, foils, vapors, smoked. It's inhaled. Cookers and occupants in a house can get high without using. A while back, I had a chance to work with a cooker that had been in the federal prison system for some time, and we wrote some information to help law enforcement as well as Department of Health folks understand what happened in houses. He had 13 and a half days straight where he never used methamphetamine, but he stayed up. And of course, by the ending time, he was quite psychotic. People that manufacture are at risk, even though they are not directly using the meth the way we think about using on purpose, but the vapors themselves create the issues. Some people snort it. Occasionally, some people make the mistake of rubbing it in the buccal area of the mouth. This is a very toxic irritant. It does create some problems. Some people put it in food. That's not frequent. Some people actually inject it with a new needle. Some people inject it with a clean needle. And many meth addicts believe that you can clean a needle just by taking the syringe and putting it in a solution of bleach and rinse it out by pulling the plunger back and forth. That does not clean a needle, and many people aren't aware that in order to clean a needle, they have to take the entire needle and all of the O-rings and other kinds of rubber mechanisms with generally diabetic needles in order to make it clean. People that use it from a common container where each person has their own needle and the needle goes back into a common container. Now everybody is using after a person who may have a disease or a disorder, hepatitis or HIV, will certainly have that common container, will have that contamination in it. And when people have finally gotten to the place where they want to get high and eat it directly, now we have problems that start from the mouth all the way down through the stomach and the alimentary tract, and have some colon and intestinal kinds of problems. So the use patterns can be very problematic. And of course, law enforcement knows that needles get hidden in pockets and bras and underwear. It can actually be aligned with the body cavities inside of underwear or other places, armpits, in shoes, in hair, and hats. And you all may know some other places that I encourage you to share with your colleagues so they don't find out the way many law enforcement people have found out after they've got a stick about where people hide or where in auto vehicles they hide needles, things like that. Occasionally, law enforcement officers will ask somebody, often a woman, do you use a needle to shoot up, to inject, to get high? Many women will answer no, even though you see marks, you see tracks, you see needles, you see it in toes, you see it in arms, you see it in hands. When you ask somebody and they say no, they do not use the needle, if they are very literal, which means their brain functions are not connecting your question with the intent of your question, they may be telling the truth if, in fact, they let other people shoot them up and they do not do that themselves. So literalness, sometimes with some meth addicts, is a problem for law enforcement because we think they're lying to us when they're really just being very literal to our questions. The progression of meth addiction, normal, low risk, even though it's illegal. You won't generally have problems with that. Problematic use, something is happening in the person's life. People maybe are complaining. Maybe they're noticing a change. Maybe they're ignoring their family, their friends, and other things. Then once they get to a place where they can be diagnosed, the first diagnostic term is called abuse. It's a medical term. A psychiatric term that means there's problems in living, occupation, legal, those kinds of things. They might have an arrest or two. They might not be taking care of their kids correctly. They might be missing work. They might have illnesses related to crashing and coming down off meth. Dependence is a physiological term and psychological term for the kinds of ways in which meth now controls the body. There are approximately 7 different criteria that are used by persons in the medical field to diagnose with dependence. When a person has dependence, they are at the point where the meth is taking the meth. They generally have a kind of craving, physical and psychological, that says, feed me, I need this. And when a person has gone through treatment, and some people do get sober, and they still have cravings regarding their methamphetamine, it's because their brain has not caught up with the fact that they're not using. We have physical dependence and we have psychological dependence. Psychological dependence is related to the dopamine system in the brain. It is the pleasure center of the brain. It is the area of the brain that says, I like this, I need this, give me more. And as law enforcement officers, when a person is in that mode, any respect they may have had or some respect they may have had for you before they got in that mode is fueled differently by their brain and their body saying, feed me. And so they lose their respect for you just because of the psychological and the cellular craving. We have system effects in the body. Now, this is where all that pollution comes in. We have essential and precursor chemicals that affect a person during the use phase, the intoxication phase, when they quit using, called the withdrawal phase, and what happens after they quit using and get into sobriety, called the post-acute withdrawal phase. Some colors of meth are actually related to ingredients that may cause longer-term impairment. The pinks, the reds, and the clear and the white colors tend to be not as damaging to the systems as the browns, the purples, the blues that have certain kinds of very toxic chemicals that have negative effects on the brain and other body organs. The system effects, and this is work that I did by going into the pharmacology books that I could find with the list of all the chemicals. I took a look at the most different chemicals of the 300 and looked at between 150 and 200 of them and how they affect the systems in the body. The central nervous system is connected to the 4 other systems: the heart symptoms, the MUCOUS symptoms, the respiratory symptoms, and the gastric symptoms. And I want all of you for just a moment to know that we encounter people with heart issues, and there's emotions that take place. We encounter people that have problems with upper respiratory infections. We have problems with people who have obstructive pulmonary disease. We encounter people that have stomach aches and certain kinds of problems in their body. Sometimes we're on the scene before the ambulance gets there. But the brain controls the other systems or interacts with them. And there are certain symptoms from the methamphetamine that will change and alter each of those body systems during the intoxication phase and will stay in the system during the withdrawal and during the post-acute withdrawal symptoms. If you would now, just take a look at the central nervous system. Methamphetamine will cause headaches. When people have headaches, they get kind of upset. Some people will get dizziness from certain chemicals. When people get dizzy, they get a little disoriented and they get upset. Mental status change. They forget things, they can't process quickly, they don't form sentences. Some of the substances cause the body to slow down and can put a person in a coma. There can be seizures related to the substances. There can be some shakes in the body, slurred speech, and even death. The central nervous system is that brain system that is impaired quickly or change quickly when a person uses methamphetamine. The cardiovascular system, a person can collapse. They can have such a stimulant effect that the heart goes so fast, they say, what's wrong, what's wrong? They get into a panic. Or occasionally, coming down, their blood pressure will drop. They will get so excited, the blood may not flow to the fingers and to the toes. They may have a heart attack, they may die. People that have increased heart rate to the point that they can't stop it and they can't think about how to stop it, if they're encountered by law enforcement, they're going to be in a panic mode. You may not understand that what's going on. They have a fear right now that's really causing problems to them. The MUCOUS system, the eyes, the nose, the mouth, the esophagus, the stomach, all of these things can have a negative effect because many of the substances are an irritant. They will break the skin, they will change the cells. Redness in eyes, not only from the inside of the body, but from the smoke. There can be swelling, there can be nasal stuffiness. And certainly with cocaine and other stimulants, methamphetamine, there's often problems inside of the nose where there's bleeding that takes place, and that creates some panic. Blurred vision might mean that the person does not see and process you correctly when you encounter them as a law enforcement officer. And you may not know that they're not seeing effectively. Occasionally there's excessive eye movement, and occasionally with some ingredients that will actually cause with some people paralysis of the eye movements. In the respiratory system, this is the breathing system. There may be chest pain, there may be wheezing, cough, shortness of breath. They may have chest spasms. They may have a tough time getting their breath, tightness in their chest. This is panic for the normal person. It is also panic for the methamphetamine user. You see them on the street, they're having the symptoms, you stop them, they get out of the car, they stay in the car, and they're having those symptoms, and then all of their brain symptoms are added to the body systems, and they're just in a panic mode. Gastric symptoms, when people are eating meth or taking meth in food, they may discover that they pass blood through the rectum. This causes some bad feelings. This causes panic. They may have an anorexia. They lose their appetite. The stimulant effect of meth is, I don't need food. I don't need food. I am invulnerable. Gastritis, irritation in the mouth, throat, sores, might mean that they're more susceptible to certain kinds of things. And maybe they've contracted some other kind of disease. So these are the symptoms that are affected just by the ingredients, sometimes even before, if the person smokes them, the smoke, the heat actually changes and alters the ingredients. So as law enforcement officers, how do the chemicals affect the system? They break each of the systems of the body down. How does that translate into safety, behavior, and preparedness? Because you can't tell it generally unless you see their arms and you get a chance to see more of their body, but you might know that they are responding inappropriately to your encounter with them, especially if you don't know that they've been doing meth. And helping them feel better might be a way to assist in your intervention with them. The cycle of meth use, some of you have seen this before. We're going to talk about it. These are the different stages: the rush, the high, the binge, tweaking, the crash, and again, the crash and the withdrawal. The negative effects of methamphetamine on the mind. This is extremely important. Methamphetamine changes what's called rapid eye movement sleep. When people do not sleep well, they have paranoia. They develop psychosis. They develop suspiciousness. When we are suspicious of somebody, we tend to want to protect ourselves. The nature of meth is to change. The nature of meth does change sleep. The suspiciousness is not controllable because of the meth use. Excessive talking. This distracts the person. They don't hear their chatter. They do not hear their rate of speed. And if they do, they don't worry about it because they don't think that you're going to be hearing it. Excessive excitation. They may misread the cues that they see from you. Saying hello in a very fast and strong voice, they may misread that as they're not greeting me, they're yelling at me. And of course that is their issue, but sometimes it's helpful to know that. Panic, fear, and danger, that's there. The anxiousness that comes with increased heart rate, that's a loss of control. The nervousness, how can I escape? They're nervous, it translates into how can I escape? How can I have this person leave me alone? And the moodiness and irritability that comes without sleep, with longer-term stimulant use and excitation translates to a get off my back, not only you, law enforcement officer, but everybody else. The three patterns of use are low intensity. We generally do not encounter them. The Binge are the most contacts for law enforcement, and the high intensity is now a lifestyle of the person, and the danger is not as much due to impulsivity as meth lifestyle, that yes, they will be impulsive, but they no longer make decisions that even people in the Binge area make. The meth seems to control their life. And this is on a continuum, but the high intensity is truly the dangerous person that when they hit somebody, they overhit over and over and over. The meth production, I would like you all to remember that people that are involved in meth production and distribution as an occupation, that's criminal behavior and should be treated as such and not looked at as addictive behavior. And yes, some of them may be addictive, but this is adult antisocial behavior. This is not regular, what we would call regular addiction. These are career criminals. This is the binge cycle. The rush, 5 to 30 minutes. Heart rate increases, blood pressure goes, pleasure for most, adds to my invulnerability, bulletproof and 6 foot tall for the person who's 5 foot tall. That's the belief that actually is initiated with stimulant use in the meth people. The high, the person feels aggressively smarter and becomes argumentative. Meth is an excitatory stimulant that gives pleasure to the person, and they do not see their fallacies. Yes, they even think they're smarter than you. It increases negative risk-taking behavior, and they're going to argue with you just for the sake of arguing without realizing that they're arguing. They're just trying to help you understand that they know things better. It's the nature of how that meth works. The high lasts for that long. The binges can last 3 to 15 days. The high here lasts for as long as possible, becomes hyperactive mentally and physically. The person has the drug effects within several systems, definitely the central nervous system, the cardiovascular system, and if they haven't been eating, in the gastrointestinal system, and their body is not maintaining, but they are not processing that. In the crash, the abuser does not pose a threat to anyone during the crash. There are times that law enforcement officers know that they have to go and take somebody in custody when they've crashed, and if that person is abruptly awakened and they happen to have weapons close by, then certainly the law enforcement officer is going to be at risk at that time, just like anybody who would with a startle response. And some will have a more significant startle response. I'm sure that many of you as law enforcement officers have been close where somebody was crashed, and sometimes hard to wake them up. When they turn back to the normal state after they have crashed, and generally for a person that's going to be involved in the repetitive cycle, we're looking at 2 to 14 days before the cravings are saying, feed me, feed me. The abuser does not understand that they are slightly deteriorated from their regular normal state before they started the abuse. And if they are into their first or second year, each time they come off of meth, they believe they are getting better, where in fact they have lost some cognitive, some brain ability, because the brain is absolutely not functioning accurately. We're going to show you some pictures of brain here in a moment and try to illustrate it for you. Withdrawal, 30 to 90 days is a common kind of withdrawals. There maybe not be any immediate symptoms. The craving for meth hits and the abuser often becomes suicidal, and this is a high risk time. If you find out that somebody hasn't used after 30 days and they're starting to cry, they're starting to feel bad, and people saying they're talking funny, you may actually be coming across somebody who's suicidal. And you know, I'm sure from your training that if you approach somebody who has a weapon who is suicidal, that weapon may be used 2 times before that scenario is dead. So we don't want it to be used against law enforcement. We don't want it to be used against the person. But the nature of the meth withdrawals may be that they are not going to process you as a helper at that moment. They're still in kind of the panic mode when they see you. They may be anyway. And taking meth at any time here actually will give a chance for them to feel a little bit more pleasure. They may not have the highs that they had the first time, and generally they're going to use a little bit more to try to achieve that first high. The short-term effects, the user knows something is wrong. And these are some of the things that they know. If you come up with somebody and you notice that they're sweating and they shouldn't be sweating, and that person has an extreme raise in body temperature, that's a medical crisis. If you find somebody who is down, you find out that they've been using meth and they've got some needle tracks or whatever, and they're having convulsions, if they are panicky, they're really paranoid, they're having hallucinations, these are now medical crises. And this is unfortunately a time that you may be at risk if you try to intervene. They may not understand that you're telling them what you are observing in full faith to try to get them some help. They still may wonder what your real motives are. The user knows something is wrong. They may have some uncontrollable movements, and you may already encounter somebody who's used for a short amount of time, and they have some of the meth bites, the meth bugs, the sores on their body. The skin is connected to the quality of the intestines. The liver, the toxic substances are coming through the bloodstream and coming out of the body, and the person does not like what it's doing. It's causing itching, and so they try to help it along. The pictures that you might have seen are somebody that you might have encountered that's got their arms cut open. They're trying to feel better. They don't know that it is meth. They're convinced it is because they may see meth bites with it, meth bugs with it. Short-term effects, false sense of confidence to severe depression in some people. Long-term effects, fatal kidney and lung disorders, brain damage, hallucinations that don't go away, disorganized lifestyle. We really got some problems long-term. This is community pollution. This is family pollution by this time. These are some of the other things to take a look at. Death is the bottom one. Malnutrition, bad coping skills, inability to work. Somebody that you might have known that was an executive, one of the supervisors, somebody who was the teacher, they can't do it anymore. The most dangerous state of meth abuse for the abusers is the tweaking. Medical personnel is tweaking. For law enforcement, you see their behaviors, they don't see it, they don't know their behavior, and accordingly, there are some things that you're going to have to do in order to take care of them. Tweakers and abusers not slept for 3 to 15 days. Paranoia is extremely common. They often behave or react violently. They don't know that they're behaving or reacting violently. They do know that they may have smacked their significant other. They may have hit their kids. They know that something's wrong, but they're not processing because there's actually a change in brain functions. The tweakers using alcohol or another depressant, their negative feelings associated with danger intensifies. And with the alcohol, they may not have a regular pain response. It may have lessened. And if you have to place your hands on them and you use pain restraint tactics, they may not actually feel it because they are stimulated and depressed at the same time. and there's more likely that physical damage results in tendons, muscles, connective tissue, or bones. Overuse of handcuffs here at this point, they may not feel the pain that people who are not using methamphetamine would feel. Well, later on, some officers discover the kinds of damage that has taken place, and it's because if they're using alcohol and meth, there may be that pain decrement that didn't allow you to do your job. The tweaker craves more meth and may switch the route of use from one form to another. When you're working community and you hear that a person now is shooting up where they were just snorting or smoking before, that's a warning sign. If they're eating, and eating tends to be the last area that they really hit. They want the immediate substance, at least in my experience. No dosage will help recreate that euphoric high, which causes problems with their frustration that leads to more and more unpredictability and potential for violence. Their eyes can be clear, their speech can be concise, their movements are brisk, tolerant causes these things. They're not aware of it. You see it. Their eyes may actually appear to be moving 10 times faster than normal. You may notice what you consider to be nystagmus. You're right. Voice has a slight quiver. Their movements are quick and jerky. This is an issue that their brain is not connected with their body. When you notice their arms are not working correctly, their hands, it's a jerky movement. And they're involved in all kinds of things at this point. Tweakers are involved in those. They may also, you may hear about people going to some of the house parties. Sometimes they're involved in spur-of-the-moment crimes and assaults, and that's where you're going to get a hold of them. Now, there are some tips, and some of you have seen these tips before. Keep a safe distance. Coming too close actually does several things. One of the things that it does is may change your escape safety net if necessary. Normal space boundaries for a meth-impaired individual are not at play in the encounter. We all have 2.5 to 3 feet of personal space. The meth's is at least double that. At 7 feet, you are at the edge of their personal space. They need that amount or a greater amount to feel normal. Some officers have found that a sideways stance, instead of chest facing them, a sideways stance helps calm them down. It's not looked at as aggressive. Do not shine a bright light directly at them. The tweaker is already paranoid, and if blinded by a bright light, they may become more violent. Bright lights also disorient a person further that's already disoriented. Their pupil reflexes are not going to work normally, and they're going to have panic. But you can use a bright light tactically, and you likely know how to do that. With another officer present may be an effective strategy to restrain somebody. Slow your speech. I encourage you to practice lowering the pitch and slowing the pace. Everything's going to be all right. I'm here to help. Use their name if you know their name. Lowering your speech, slowing down, using a deeper tone, changes and alters their pattern of familiarity that's going on inside of their brain. In other words, you're hoping their brain to catch a bit more of reality. You slow your movements. Furtive movements may be misperceived. You might even decide that you're going to tell the person you're going to back up a little bit, if that's okay with them, or you're going to come a little bit closer, and you'd like to take a look at their ID, and you're going to extend your hand. Sometimes letting them know what your movements are going to be really helpful for the person that is tweaking. If you keep your hands visible, it's a safety net when you encounter a psychotic person, somebody who has a mental illness, who doesn't even have a stimulant use. That is always a good practice. Here, the person with stimulant use really kind of looks like some of the folks that have mental illnesses, because they're misperceiving cues. Some officers find that showing the person their palms is a way of reducing their anxiety and paranoia. And paranoia is almost always present. Extending a hand for a handshake, if natural, is really good. However, if the person does have a really strong grip, probably do not want to match their strong grip. Keep the tweaker talking. When they're talking, they're connected. Engaging is a discussion, and the discussion of the use helps keep them connected. I really want you to know that the longer that they talk, if you suspect there's dangers, that can help with extinguishing some of their fears of you, and they develop familiarity with them. Connecting is a good part of officer safety. Here's the brain activity. We have, and these are provided by Dr. Danny Ammon from the Ammon Clinic. Here we have a brain, and there's not holes in a brain. These are pictures of brains related to neural conductivity, related to blood flow. And here we have 28 years of heavy use. This is not a normal brain. This is a illustration to you that there's disjointed thinking, there's confusion going on just because of the meth use. The toxic substances are what interrupts the nerves, the blood flow, and the transmission, the communication transmission pathways in the brain. On the right side there, you see what no meth use should look like. A normal brain should look like. Meth brains don't look that way. Here's a meth brain on the left during substance abuse, and this is 1 year of alcohol-free on the right side. Meth brains look worse than alcohol brains. Here's the underside. By the way, this is a nicotine and caffeine abuse brain. For those of us that live on cigarettes and coffee, it even does affect our brain. Coffee and nicotine can both be a stimulant. I show that just so you understand that the brain changes its neural functions, and it takes a long time, months and months, for it to heal. The duration of effects of meth, onset of the effects is rapid following smoking or IV use. It's a little slower if there's oral use. The overall effects last 48 hours. Residual effects can last up to 12 hours. The longest dirty urine I've seen when we've had a person that was spent in custody is 96 hours, where they were still showing a dirty urine. Their liver system, their kidney system definitely are not working right. The shortest has been about 24 hours after the last ingestion. Methamphetamine, something for all you to know, that methamphetamine may restore alcohol-induced impairment in simple, repetitive tasks of short duration. In other words, somebody who has been drinking meth will offset some of the alcohol effects, but it does not restore balance or steadiness or thinking process per se. It gives the person a sense that something is, in fact, not right. Meth users crave, they want more substances. Low-risk users want to repeat. And with that, what we're going to do is we're going to go to some questions and answers now and turn it back to Tony.
Thank you, Doctor. And there's a couple more slides left, but for the sake of time, we need to be able to get a couple questions in that we have from the audience out there. By way of reminder, you'll be able to pose questions during this session in the Q&A box after the webinar, immediately after you receive a brief online evaluation of polling today's webinar. Please take a couple minutes to assist us in providing your assessment and feedback, and we appreciate your input. I have a question out there. One of the questions we have is there a medication out there for meth users in treatment, like there is methadone for heroin users or Suboxone for heroin users?
You know, there are several programs that do use some things that help meth users through withdrawal and reconstructing some of their neural pathways. Definitely multivitamins are extremely helpful. Thiamine, folic acid, multivitamins, prenatal vitamins for male and female are often really helpful. There are some of the naltrexone and bupropions that actually change and alter the opioid, the dopamine sites in the brain that will block some of the craving. This can be especially helpful in getting people who come off of methamphetamine. There are some practitioners now in trials that are utilizing substances that put methamphetamines into a very relaxed state with extended periods of sleep, hopefully to reestablish rapid eye movement sleep quickly, to get rid of some of their paranoia, some of their misreading themselves and cues, and have them return to dream states, which is a part of normal brain functions. And yes, there are some treatment programs that use some substances in the rehabilitation through the first several months of the meth addict's rehabilitation. We're really looking at extended rehabilitation up to about 9 months to a year if it's going to work very effectively.
Very good. And doctor, have you seen, there's different types of methamphetamine out there. There's what's called D and then DL meth that represent kind of different qualities of meth that are produced. Do you see, or can you distinguish different types of quality of meth in some of the people that you treat in terms of what they're using? Actually,
I think I usually notice that in the ER before we even get them into treatment.
Okay.
And what I've discovered, and I often ask them if they will let me go to their home and take a look at what kind of meth they have. Sometimes I ask if they will let law enforcement bring me the needles in and some of the foils that they've had. And you'd be surprised at how often some people will let do that. But some of the colors that I find really affect cognitive functions are the browns, the peanut butter looking, the purples, and those kinds of things. Is there a difference? The thing that we have to consider is that every person that uses meth has their own personality style, their own kind of genetic constitution when it comes to their brain receptors, and they have their own systems that will respond to different chemicals. So it would be a difference between how the person fits with the methamphetamine. Not everybody's going to respond to the different, what we believe to be the different types of methamphetamine the same way, because we are not all genetically and neurologically and endocrinologically, it's a tough word to say, the same. Our bodies process different. Some of us have discovered that people who are now using meth used to use coke, used to use alcohol, and actually the brain centers have been compromised from other substances, so they have different reactions than people who might actually have only smoked marijuana and then go on to methamphetamine.
Okay. Very good. And it does. And finally, the last question is that, we've heard that the brain has a remarkable capacity to rewire itself and fix itself. So is there good, with proper treatment, can a meth addict recover fully from the addiction?
Actually, from my experience, I would say not only can they recover fully, but there are studies that show with the kind of those SPECT images, those colorful brain images, that their brain looks like it has completely healed. What doesn't recover fully is the memory of the pleasure that comes from that. the deterioration of the family pollution or the community pollution, and sometimes the manner in which a person can actually go back into a community, maybe without felonies, or maybe to be able to achieve the same kind of work. I think the brains can often recover better than our society allows the ex-user to recover.
Okay.
That's a great question.
Very good. I thank you. That's about we've drained this completely dry in terms of time and gone a little bit over, but very important, great information that we've gotten, especially for law enforcement officers in terms of what they see and how they should approach and what to expect. You've already received polling questions. If you've been on, please take the time to do the polling, and I thank you on behalf of our SAI, our Meth Fellows, the COPS office. We'd like to thank you. Thank Dr. Strickert for today and our audience for taking the time to join us. If you have additional questions related to calls, please send an email to our presenter or to us at SAI, and we'll get back to you right away. Second, if you listen to the location on the Methpedia website, will be the PowerPoint and the presentation will be located. You or someone want to know to access them later. Again, for those who may only be listening, the location is www.methpedia.org, COPS-tribal-meth. Thank you, and this concludes today's training and technical assistance webinar.